Hi, my name is Lena, and I want to talk to you today about informed consent. And what that means is when a client enters into a counseling relationship, the counselor is obligated to provide the information that's necessary for the client's informed consent. All codes of professional counseling ethics require this informed consent and may state practices, laws mandated to it. The informed consent advised the client or the counselor policies, state and federal laws, and client's right. A signed copy of this form should be kept in the client's chart, and a copy should be available to the client upon request. Counselors may choose to post a copy of their form in the waiting room. Informed consent document can take many forms, but certain information it is critical so the client can truly give his informed consent and the counselor can comply with state laws and code of ethics. These document protects the client and the counselor. One of the ones I wanted to really pay attention to was confidentiality. I'm big on confidentiality, just in general in life. And what is confidentiality is give your confidentiality policy regarding verbal communication, clinical records, and or psychotherapy notes as needed to confirm to state and federal laws. Most confidentiality sections advise their clients' information shared with you is confidential, except in the following circumstances. And this is where sometimes it can be tricky. Diagnose and dates of services shared with the client, insurance company, building insurance to collect payments, mandate reporting or physical or sexual abuse of children, cases where the client signed a release of information release as outlined in the HIPAA notice of privacy practice if you are HIPAA compliant, those required by the law. Provide a line where the client signed and date it. I mean, it's simple, but yet it is very important that these things are not missed. And then sometimes you do have emergency situation. Your informed consent document needs to be outlined for your client. What they need to do should an emergency arise outside of your normal business hour. Moreover, if you are a managed healthcare provider, these entitles entries requires you to have a protocol in place for emergency. But these protocols may take many forms. Even as a counselor, you should have an emergency consent situation just in case something happened. Advising the client to call 911 or whenever emergency services are available in their communities. A special telephone number to call, advising clients to go immediately to the nearest emergency room. And so I think that this is important because whenever the protocol is the client needs to be informed in writing before any emergencies occur. The emergency protocol needs to be confirmed to your state guidelines or be evaluated to what other clinicians do in your area or your community standard. At the end of this section, include a line where the client signed and date it. There are certain things that we just need to just have in place when it comes to confidentiality. And one of the other ones I thought was interesting as I was reading, even when it comes to recording someone, some people are recorded in their time of counseling, and you definitely have to have a consent for that. Some people do a lot of work now remotely. Um, in it for some clients that don't need to come in the office this work also, but there should be a informed consent stating the confidentiality and stating that this is allowed um, to be done to protect yourself and definitely to protect those that you are seeing. So this is my information on implementing informed consent. Thank you.